Welcome to this explainer. Today, we're totally demystifying breast cancer. We're going to break down the biology, the modern treatments, and the really hopeful reality of survivorship, all backed by the absolute latest medical guidelines. All right, let's dive right in. Here's what we're covering: the biology of breast cancer, risks, signs, and prevention, screening and diagnosis, modern treatment strategies, and finally, the road to survivorship. Okay, part 1. The biology of breast cancer, the foundations. So at its core, breast cancer is a disease that kicks off when abnormal breast cells start growing out of control. They form a malignant tumor, and if nobody stops it, that tumor can invade nearby tissue or even spread to other organs. And here's something that actually surprises a lot of people. While we mostly hear about it in women, it can absolutely happen to men too. It all starts with a simple disruption in the normal cell cycle, something literally anyone can experience. Think of it this way. Normal cells have this beautifully regulated growth. They're governed by things called tumor suppressor genes, basically the brakes of the cell. But cancer cells? They're driven by DNA mutations and oncogenes that essentially slam on the biological gas pedal. This causes wild, uncontrolled growth and triggers something called angiogenesis, where the tumor literally builds its own blood supply to feed itself, before eventually metastasizing. Now, a really critical distinction doctors make is between non-invasive and invasive cancers. Take DCIS, for example, ductal carcinoma in situ. This means the abnormal cells are completely trapped inside the milk duct. It's totally non-invasive. But compare that to invasive ductal carcinoma, or IDC. That's when the cancer has broken out of that duct and into the surrounding breast tissue. Spotting this difference is a huge deal, because it completely changes the game plan for treatment. And going a bit deeper into the biology, doctors don't just look at location. They look at the tumor's unique molecular fingerprint. There are 3 main types. You've got luminal A and B, which are hormone receptor positive, meaning they literally use hormones like estrogen to fuel their growth. Then there's HER2 enriched, driven by way too much of the HER2 protein, and finally triple negative, which actually lacks all 3 of those common receptors. So why should we care about this? Well, identifying the exact subtype is the master key. It directly tells us the patient's prognosis and exactly which targeted treatments are going to work best. Moving on to Section 2, risks, signs, and prevention, knowing the factors. When we talk about risk factors, medical science usually splits them into 2 buckets. There are things we just can't control, like getting older, being female, having dense breast tissue, or carrying those BRCA1 or BRCA2 genetic mutations. But here's the good news. There are powerful prevention tools firmly in our control. Things like maintaining a healthy weight, especially post-menopause, staying physically active, and keeping alcohol consumption in check are massive when it comes to lowering your risk. Now, recognizing the symptoms early is an absolute game changer. The classic one we all know is finding a new lump or thickening, but you've got to watch out for visual changes too. We're talking unexplained shifts in breast size, skin dimpling, or a very specific orange peel texture that doctors call peau d'orange. Other major red flags: nipple inversion, bloody discharge, or swollen lymph nodes under the arm. If you see any of those, you definitely want to get them checked out right away. Look, it is incredibly easy to panic if you notice a change in your body. It's totally natural. But we have to ask, does every single breast lump automatically mean cancer? Or could it just be something completely harmless? That brings us to Section 3, screening and diagnosis, finding the answers. To get those answers, physicians follow some pretty strict guidelines from the WHO and NCCN. They use a 3-step process called the triple assessment. Step 1 is a thorough clinical exam and going over your medical history. Step 2 is diagnostic imaging. And Step 3, if anything looks suspicious, is a biopsy. Honestly, you need all 3 of these to be 100% certain about what you're dealing with. Let's actually compare steps 2 and 3 for a second, because people mix them up a lot. Advanced imaging, like a 3D mammogram or an MRI, is amazing at spotting that something abnormal is there. It draws the map. But actually extracting the tissue for a biopsy, that remains the absolute gold standard for a definitive diagnosis. It gives pathologists the actual physical cells so they can test for hormone receptors, HER2 status, and check the Ki-67 index. Think of Ki-67 like a speedometer for the cancer cells. It tells the doctors exactly how fast those cells are dividing. Once a diagnosis is locked in, the cancer is staged from 0 to 4 using the global TNM system. T stands for tumor, looking at the size and extent of the main tumor. N stands for nodes, checking if the cancer has snuck into the local lymph nodes. And M is for metastasis, which is checking if the disease has unfortunately spread to distant spots like the bones, liver, lungs, or brain.
All right, Section 4, Modern Treatment Strategies, Multidisciplinary Care.
For a lot of patients, treatment kicks off with or heavily involves surgery. A lumpectomy is breast conserving. The surgeon just takes out the tumor and a tiny margin of healthy tissue, which is fantastic for early-stage cancers. A mastectomy, on the other hand, is the complete removal of the breast tissue, usually reserved for more extensive cancers or for patients with a very high genetic risk. And practically speaking, both of these are usually paired with sentinel lymph node biopsies, just to make sure the cancer hasn't started traveling. But surgery is really just one piece of a much larger puzzle. Outside the OR, oncologists have this incredibly powerful arsenal of systemic and targeted therapies. We're talking traditional chemotherapy, which can actually be given before surgery to shrink a tumor down or after to sweep up any leftover microscopic cells. We also have radiation therapy, and remember those molecular subtypes we talked about earlier? That's where targeted therapies come in. Things like tamoxifen for hormone-driven cancers, trastuzumab for HER2-positive ones, and even cutting-edge immunotherapy for some of the more complex triple-negative cases. So what does this look like in the real world? Imagine a patient diagnosed with HER2-positive cancer. Instead of rushing straight to the operating table, their journey might actually start in month 1 with chemotherapy combined with targeted drugs, specifically designed to shrink that aggressive tumor. By month 6, they have surgery to remove whatever tiny bit is left. Then, stretching into year 1 and beyond, they stay on that HER2-targeted therapy just to ensure the cancer stays gone. It's highly personalized, modern medicine in action, and it's pretty amazing.
Finally, Section 5, The Road to Survivorship, Life Beyond Treatment.
Surviving the initial treatment is obviously a huge milestone, but the rehab process is rigorous. It takes serious dedication. We're talking physiotherapy to get shoulder mobility back after surgery. Patients also have to actively work on preventing lymphedema, which is a really painful swelling that can happen if lymph nodes are removed. Throw in aerobic exercise, heavy fatigue management, and maybe most importantly, dedicated mental health support to process the emotional trauma of the whole experience. Looking even further down the road, long-term survivorship requires a lot of vigilance. Major oncology groups like ASCO and ESMO emphasize that we need regular monitoring to catch any recurrence early, but it's also about managing the hidden toll of those harsh treatments. You have to monitor bone density, keep a close eye on heart health, and manage things like chemically induced menopause. Basically, survivorship is a full-body, holistic commitment to staying healthy and active. And all of this brings us to a really powerful, science-backed reality. Thanks to decades of relentless research, breast cancer is now one of the most extensively studied and treatable cancers in the world, as long as we catch it early and throw the full weight of modern, multidisciplinary care at it. As science continues to map out and conquer the biology of this disease, we're left with a pretty profound question. With survival rates improving so dramatically across the globe, how can we, as a society, as caregivers, and as healthcare systems, do a better job of supporting the lifelong journey of the survivors living right here in our communities? It's definitely something worth thinking about long after this explainer ends. Thanks for hanging out with me today.